before you kind of mentioned about certain myths. What are the top three myths about chiropractic that you should debunk right now?
Number one, once you start, you have to keep going.
Mm-hmm.
That's not true. It is, I always say it's kind of like exercise. Once you start exercising, you're feeling good. It's a good idea to continue it. But if you decide to stop, you're not worse off for having done it.
Mm-hmm.
So that's number one. You don't have to keep going, but it's a good idea, like you said, to get tune-ups. We do try to minimize it, give people exercises and things and lifestyle things they can do at home so they don't have to come in as often. But if you want to keep everything working perfectly, tune-ups are a good idea. But again, you're not worse off for having not done it. Number two, neck adjusting and strokes. That was a myth that was that is caused from a selection bias. People with neck pain often come see chiropractors, right? And one of the first symptoms of a neck stroke is neck pain. I had a case where a fella came in with neck pain, and he also had some numbness in his face. Hey, I did a neuro test, sent him to the Emerge right away. I got a phone call a couple days later saying that I caused a stroke on him. I said, what? I said, I just did the exam and sent him to you. And then he hung up. That was the emergency room doctor, thinking that I caused it. Mm-hmm. But actually, I'm the one that sent him to him. So, I mean, but that's a selection bias when people have that. Yes, there's an association because the patient had neck pain and happened to see a chiropractor. But because it went to a full stroke, it had nothing to do with having seen a chiropractor. Number three, I guess just the popping noise. Some people think the popping noise is bone grinding on bone, but it's just really an air bubble forming inside the joint, just like when people crack their knuckles. It's just an air bubble forming in there. It can't go anywhere and hurt you. It doesn't hurt. It doesn't matter if you're tense during the adjustment. The adjustment will work just fine. I guess those would be the top three.